So, welcome to the latest in the series of chats about the survey on recruitment and retention within the veterinary profession. Today's chat is going to focus on veterinary nursing and the results of the survey that related to nurses' opinions about recruitment and retention. We're really pleased to have with us today Renata Weller, Beaver president, who was part of the team that put together the survey in the first place and coordinated the results. We're also lucky to have with us Belinda Andrews-Jones, who brings with her 28 years of experience as a veterinary nurse, and also Marie Rippingale, who's a great friend of Beaver and a registered equine veterinary nurse with, I think, 16 years experience. Marie.
Yes.
So you've all had a chance to have a look at the survey and the results of. I hope you found them as interesting as I did. But there are some things that I'd just like to pick up and get your views on. So the first interesting point I thought were that over half, 54% of nurses who responded to the survey said that they'd be looking to change jobs in the next couple of years, and 14% said that they would be looking to leave the nursing profession within the next couple of years. Belinda, does that surprise you? Do either of those figures surprise you? And far away.
It does surprise me in some ways. From the research that I've done myself, it doesn't always collate to what I'm seeing at practice level, and certainly for practice that I work at is not that high with it. But I can see why this is kind of happening and why what the problem is. So it's not a massive surprise, and I think there's lots of things we can do to turn this around and change it, but we just all got to work together to make a change.
Renata, were you surprised by the number who are looking to change jobs in the next couple of years?
Not necessarily. I mean, it's very comparable between veterinary surgeons, these results, and there's huge movement in the job market with 50% allegedly wanting to change. I mean, it's always a little bit of a difference saying I want to change and then actually taking this step. But for 50% or over 50% to be willing to consider it, that's huge, I think personally. And like Belinda, I mean, I think there are a few factors that we can or have identified that lead to that desire maybe to go and try to find greener pastures. I think it's good because it's a little bit of a wake-up call as well. So we know we need to do something. So I think the next is that we identify exactly what we can do, basically to make people happier.
And Marie, do you think that's those sort of figures are a reflection of just the modern working environment, or is it something specific about nursing in the veterinary world that makes people want to move more than they might do in other areas of life?
I think it's more of a mismatch in terms of what's causing people to want to leave. So I think there's problems with salary and also recognition. And if we could iron those problems out, they're a total mismatch at the moment, which is why I think you'll find a lot of the nurses want to move on. And I think, like Renata and Belinda are saying, if we can address those issues, I think that we can, make everybody happy, have a stable team, and hopefully retain nurses moving forward.
So, Belinda, do you think that the fact that you've got 14% wanting to leave the profession is an indication of people not being happy with the role of a veterinary nurse? But do you think with the fact that we've got another half of all respondents saying they're looking to change jobs means that they love the job, but they don't love the aspects of the place they're working with, and therefore they're seeking better positions elsewhere?
Yeah, I think we need to open up with what nurses can do, and rather than the nurses doing some certain roles, we need to open it up much more to allow nurses to do huge amounts more that we can do. Why can't we be like human nurses that do a huge amount more? I'm very passionate about allowing nurses to be able to be everything that that a human nurse can do. Why can't we do it? So why can't we prescribe certain drugs? Why can't we prescribe vaccines? Why can't we do certain procedures? Do much more than we can. And this will help with the whole process of it. This will help with pay and retention of nurses because they have a much more fulfilling role, but also we'll be able to pay them much more because they'll be able to do much more, have more responsibility within the practice. But we also need to work on veterinary surgeons to let nurses do more, because some nurses want to do more, but they're not being allowed to do what they can do at the moment. There's many nurses out there that want to do the things that they're illegally allowed to do at the moment, but they can't. And we need to work on so many different areas of it. So it's not just within the veterinary nursing we need to work on. It's the veterinary surgeons as well to empower the nurses to be able to do certain things within the law at the moment, but also when we can actually change legislation and law to be allowed to allow nurses to do more. And then it will be able to open up so many more avenues and for career prospects for nurses. And we have to change everything so radically, but we need to take the first step. And one of the first steps is to allow nurses to do more, what they're allowed to do at the moment, let them do it, and open up more career paths.
And Renata, from a veterinary perspective, do you see that as being an issue or more of an issue in the equine world than it is in the small animal world, or is it equally true in all aspects of veterinary nursing?
I mean, for starters, equine nurses are different to small animal nurses because there's the work is different. It's also there's not as many. That's also a big difference. But I think what Belinda just said about empowerment, that matters across the board, whatever species to work with. And I think to defend my own profession here a little bit, I think a lot of the times it's not necessarily that us vets don't want nurses to do more. A little bit is also ignorance. At least, I mean, Mary has worked with us on our beaver nursing campaign that's coming out shortly, and I let her say and tell people what it is. But certainly there were a few surprises in for me, and I do consider myself relatively well informed. But I'm like, oh, I didn't know that a nurse was allowed to do this. So I think, enlightenment is maybe a big step forward, so people actually understand what are nurses allowed to do, and also what are they capable of doing as well. And I think it would be fantastic if we would use them to their full potential.
Marie, Renata's teed that up rather nicely for you. What are your thoughts?
So I completely agree. It's not vets being obstructive. I think a lot of the time they just don't realise what a big role we can fulfil. And in the Beaver Nurses project that we put together for this month to coincide with the BVNA Nursing Awareness Month, and we've put together some PowerPoints and some fact sheets for vets and nurses and anyone working in practice to just outline exactly what we can do within Schedule 3 that would help us to fulfil our career a bit more and make us feel a bit more empowered and make us want to stay in the profession, but also on the flip side for the employer to demonstrate to them how much we can kind of add as well. So how can we add value to practice? How can we make them more money? How can we continue to improve practice? So it's avenues for that as well as letting them know what we can do, and it's a win-win on either side then.
I think it's a big problem of knowing what can be delegated, and there's just a massive misunderstanding of what actual Schedule 3 means and what nurses can do, and I think that really needs to be delved a bit more deeper and much more clearer and communicated out nice and simply to all vets and nurses to understand. I think sometimes the delegation isn't there because they're vets and vet nurses are scared of, oh my god, is it are we not allowed to do that, are we allowed to do that, and there's a lot of confusion. So I think it would really help if it's much more clarified.
So Renata, it sort of sounds to me as if there's a fair amount of disillusionment within veterinary nursing. What can we do we've talked about giving people more responsibility, but what else can we do to persuade people of their value?
I mean, as most people know, I'm an educator at heart, and that's my being. So the more we educate nurses, but also, as Belinda has already said, the vets, and as well as the owners of the animals. And I think, nurse-led clinics. I have yet to see someone other than a nurse being any better in diabetic management and telling people what needs to be done. A vet can't do that. I don't think a vet can do it as well, personally. I think they're doing a fantastic job with obesity clinics. So this is their thing. They are absolutely brilliantly placed to run their own clinics. And I think we should empower them to do more of that. And I think I have to say, I think on the small animal side, it's a little bit more advanced than on the equine side, but I can't see why this wouldn't work. I mean, God knows we have enough fat horses. So I think, there is a need to run similar things there. And I think we should really work together to get these things up and running.
So Marie, I know that you put together a series of Beaver regional meetings on the role of the equine veterinary nurse and how there's the opportunity for greater responsibility and broader role. But it would be fair to say that it's been tricky to get bums on seats at some of those events, hasn't it? So what can we do to encourage, or how can we make sure that veterinary nurses have great access to CPD?
I think it's difficult. I think it's just trying to it's a fairly new concept in equine practice. As Renata was saying, it's really developed in small animal, but it's fairly new in equine. So I think it's just actually getting it out there as a concept, getting people interested just initially. And then people will start to look for the information and want the information and realise how valuable it is. So I think it's just that first step of actually just putting it out there, getting the information out there, and just letting people know that it is available, because I just think most people just don't realise that as an equine nurse you can run clinics. We're looking into developing a district nursing role. I mean, that's not a official role yet at all, but we're looking at developing that role as well. And because it's in such early stages, I think that it's just basically getting the idea out to people as we're developing it, and then kind of letting them develop with it as well.
Great. But Belinda, have you seen any models which have worked really well? Are there any practices that you've seen that have really established nurses as at the forefront of the profession?
Yes, I know quite a lot of practices that you really utilise nurses to their full potential, but you have to look at the whole kind of spectrum of the whole practice. So it's looking at reviewing everybody's job profiles and see what they do as a general process, and maximising what each position within the practice can do. So having things like people to support nurses, like patient care assistants, can be brilliant, and whether that's an equine or small animal can be massive to help the nurses do the full job that they need to do. So it kind of takes away some of the roles that they really don't need to be doing. For instance, like in the equine world, it could be people that look after, clean out the stables and things like that, and clean, do lots of hygiene and things. So the nurses don't have to do it. So they can do a full core nursing role. And where they do lots and lots of nurse clinics and do the full potential of them, doing everything they possibly can to the full max, is hugely changes the whole practice. And what we find is we have a massive recruitment retention problem for vets as well, and that massively helps that, because if we can have a fulfilling role for the nurses and maximize what the nurses can do, then we need less vets with that. So it's not such a problem with recruitment retention with vets, and also gives them better job satisfaction as well. That they I forgot what was the other part of the question you asked?
It was really what models have you seen work really well?
Yeah, it's where they basically look at where they review all of the review the whole structure of the nursing as well as from the vets, and review making sure that everybody can do everything to their full max, and that sometimes means not doing some areas that they don't need to do, and that's for all job roles. And when that works, it works brilliantly. And so they can get the full list of things like nurse consults, and the nurses doing all the x-rays and doing all the minor procedures, all these kind of things. It really does work, and I have multiple examples of how it can work brilliantly in practices.
Brilliant. And Maria, I'm sure you've had experience of those sorts of things. I know you have, but where's the driver there? Is it Is it the nurse? Is it the vet? Is it the business owner? Or is it a combination?
Tends to come from the nurses. Like, you know, the nursing qualification is incredibly thorough. We know exactly what we are allowed to do by the end of it because we're very, you know, educated in it. But I think it's actually having nurses that want to push forward, want to advance with their career, and then having employers that are open to that is the perfect combination that will trust you and allow you to kind of fulfill your career and trust that you can do what you say you can do, and then support you and encourage it in you. And I think that that is the best combination for pushing it forward and having a successful team that works well.
Great. Renata, there seems to be an anomaly in the results in that there are clearly a lot of nurses who are looking to change roles, and you would think therefore a significant number of them who are looking through the adverts, and yet there is consistent feedback that it's very difficult to recruit experienced nurses. So if all these experienced nurses want to move on, but they're difficult to recruit, what's happening? Where's the mismatch there?
That's a very that's a very mean question to give to me. This is a tricky one to answer, and the survey certainly doesn't provide the answer. So I can only talk about what I've heard and what the recruiters tell me, and what practice partners and so on tell me, and what talking to nurses, what they tell me. And I guess it's a fundamental, I almost want to say, lack of appreciation in the role. So yes, of course, if you're unhappy in your job, you look for greener pastures, and then you look into it, and then actually it's not that different elsewhere either. So there are some factors that have come out that may be different elsewhere. So, I mean, the number one that has, if you're considering leaving your current position, what is the main reason? So the top three were salary, local management, and work-life balance. So of course, these are factors you can look into, and you can negotiate a better salary. You can negotiate better working out to a certain degree, but obviously there will always be brackets. I mean, it's not like you can go and earn 10 times more, or that you all at once only work 10 hours with a full salary. So there's always brackets around these factors. Management is a bit different because that's often local management. So and I think also that goes into appreciation. So sometimes just this pat on the shoulder is also worth something, and being empowered to do things. So rather than looking at this from a specific employer point of view, I think we do need to look at it from a whole profession point of view. And I come back right to where we started, where Belinda started. I think the key word here is empowerment.
Well, and do you agree with that, Marie?
Wholeheartedly, yes. Yeah, that sounds absolutely right to me. The biggest disaster is that these nurses are looking to leave their job and actually leave the profession because they take all of those years of experience with them, and it's such a shame. And if they can negotiate a better salary, a better work-life balance, you know, and everyone can work better as a team, then that's the perfect solution. But letting them go is just, you know, is a bit of a disaster, really. Don't need to get to that stage.
My dog's joining in.
So it seems to me that that we're all accepting that there is a problem, there are challenges there, but it also seems as though we can see a way through that. So do we think I'm going to ask each of you in turn just to finish off then, but do you think we're on the improving pathway now, or do you think we've got to get on it in order not to avert a disaster? Belinda?
I think there's lots of things we need to do. I think some people are with it, and it is working. I think there's a lot of practices that aren't, and they need to really do a shift and look at different avenues, things like flexible working. You know, we have to embrace flexible working for, you know, all of our nurses. You know, we have a huge female dominated profession. We need to have flexible, sustainable, you know, nurses for the future. So flexible working has to be, you know, in every job position forward, because we can't just have the standard full-time nurse. It's, you know, it's not working, and we have to have you know, open up to different opportunities for nurses. I think with lots of work, and I think lots of things like this, discussing about what we can do for the future, discussing the problems, discussing how we can resolve the issues, I think it will massively improve. But I said, as going back to it, if we utilise our nurses properly, it will improve. If we don't, it will go worse.
Great. Renata, your thoughts? Are we on an upward trend or a downward trend?
I think we are. I hope we are on an upward trend. I love the Nurse Awareness Month, May as well. It's a lovely month, and I think us vets need to appreciate our nurses more, hands down, and I think we should, and I think we should empower them more. I would like Belinda, I would like to see veterinary nurses going the way human nurses are utilized. I like specialization. I think specialization brings job satisfaction. And I do think the RCVS is working along those lines as well with Schedule 3 and so on. So I think we can work more on our CPD offering, that we allow nurses to pick certain topics. Marie has already, she has mentioned it before, they're actually recording, that she would like to see more joint veterinary surgeons, veterinary nurses meeting. We've done that very successfully in the past on the equine radiography side. So I can't see why we shouldn't be doing that more. So I'm all for that. So
Great.
Upward trend, hands down.
Good. And Marie, the pressure's on now. Optimistic or pessimistic?
Optimistic. I think we're starting from fairly far down, but I feel like absolutely with considering how human nurses are utilised, and considering also that appreciating nurses and allowing them to do what they're capable of doing also reflects well on practice finance. It just seems a win-win situation for me, to employers to utilise the nurses. The nurses are happier, they want to stay in the profession because they're doing what they should be doing, and the practice makes more money. It kind of makes sense. So I think once we can get that message across, it's just a no-brainer, and then after that I don't think there'll be anything stopping us. That'll be it. We'll be away.
Great. Nothing to stop us. That's probably a really good point to end it on. Thanks very much, all.
Thank you.
Thank you.
Bye-bye.
Bye.
Thank you.
Okay.